Today to our Vitality Chat. Today we are very excited to have this guest. She is a chiropractor from Denmark. She has also been a chiropractor in the United Kingdom and has done some influential work in pediatrics in Europe. We have known her and studied with her for a number of years. She's an innovator and really started pediatrics in Europe and making it so popular. She has been in practice, I think, close to 30 years. Is that correct? Yeah.
Plus one, yeah.
That's one. Yeah, 31 years. So very inspiring. Well, Dr. Davidson, love to hear you tell us a little bit about your story and how you got into chiropractic.
Thank you so much. Well, I always say that chiropractic chose me rather than the other way around. I knew of chiropractic. My mom was a nurse and she went to a chiropractor for shoulder problems, but I didn't really have any experience of it personally until I started the course, really. But what I did have was a very severe car accident at the age of 19, with some severe injuries, and that sort of sent me down the road of trying to find something to help. And so chiropractic was one of the options that I looked at when I was training. And in Denmark, the system is that you pick two or three different courses and then you send off your grades and then you get the one where you fit the best. And so chiropractic chose me.
Oh,
And from the minute I started the course, I was just like, yeah, this is it. This is what I want to do for the rest of my life. The only thing was in Denmark, you could only do the first year. And so I had to choose between the United States, Canada, Australia, or England, to finish my degree. So England being nearer and and a little closer to home is where I decided to go. So I graduated in 94 from the Anglo-European College of Chiropractors in the UK. And back then I still wasn't ready to go back home and settle down. So I decided to go to Scotland because I knew there weren't many chiropractors up there. And I was offered to buy a clinic in Aberdeen, which also came with a little satellite clinic in the Shetland Isles. So I actually flew from Aberdeen to Shetland Isles every week
beautiful
for
part of the
two
world.
days.
Yes.
Yeah, that's
Oh, it's gorgeous, yeah,
All
when
right.
the weather's good.
right.
Exactly.
So my intention was to stay there for a few years and then go back home, but I ended up meeting a nice Scotsman and got married and lived in the end in the UK for 31 years before coming back home in 2021 after my husband sadly passed away and COVID sort of turned our world upside down.
It sure did.
So
Yes.
you are known for your pediatric expertise. Can
Yeah.
you talk a little bit how you got into pediatrics and a little bit about what you do actually in that world?
Yeah, so my interest was first sparked when I was a final year student at AACC. One of my co-students I was her intern, came in to see me and she was complaining of all these weird symptoms. And I said to her, "Oh, I think you should take a pregnancy test." And she said, "No, no, no, no. I've been told I can't have kids." And I
Yeah.
said, "No, just humor me, have a pregnancy test." And she was pregnant. And so she now says that I've known her son for longer than she has.
Yes.
And that kind of sparked my interest because I saw her through the pregnancy. She gave birth to him just before I graduated, and I had absolutely no idea what to do with this little toot.
Yeah.
I just cuddled him and he laughed, and I thought, oh, this is so nice. And but I have babysat before, and I have worked with kids in other ways before becoming a chiropractor, so it seemed a natural extension. And I didn't have many in my first year, but then the second year in practice, I ended up seeing what they call a health visitor in the UK. So that's the one that looks after the new mums.
Okay.
And she started sending me all the mums in her care.
Wow.
And and then the ball just rolled. I mean, literally, it was like a snowball that just never stopped. And also because I was the only female chiropractor in 100 miles radius, so women just flocked to me.
Yeah.
And
I can see.
yeah.
Yeah, it's amazing. Yes. Is there any particular inspirational story you have about taking care of pediatrics? Like, can you think of something?
Yeah. The most amazing thing I ever experienced was with Dr. Carol Phillips. I'm sure you know
Oh,
her.
yeah, sure.
I had invited her over to Scotland to do some courses. And at the same time, I had a little baby girl who was 4 months old. And I didn't know what to do with her. She had been an arrested delivery, was pulled way back out again through C-section, emergency C-section, due to mom having preeclampsia. And this little girl was completely stuck in extension. She still had a cone-shaped head at 4 months old. And I asked Carol if she would come and help me treat this little girl. So I had already done some cranial work. I'd done the SOT courses and I'd done some craniosacral courses, but I just felt I was way out of my depth with this girl. And so Carol came, we treated her together. It took about 45 minutes for a completely unwinding session of this little baby girl, with us both holding on to her. And at the end of that session, she stopped crying for the first time in 4 months and went,
Yeah,
Yeah.
amazing. I mean,
and that just blew my mind.
Yeah.
right, right.
That's amazing. Carol's amazing. I actually once had an experience of working with her on a patient too, and it's just there's nothing like it. I just remember the whole unwind, like your whole soul unwinds as you do the whole process. It's amazing. Yeah.
Absolutely.
So,
I
yeah.
mean, and think about the trajectory of that child's life, how it changes
Yeah,
the child's life, but the family's life. They have a being that's now not in a sympathetic state. They can relax. I mean, it's like it's not just the baby, it's the whole family unit that
absolutely.
Yeah.
shifts. And that's one of the things, I mean, we can track what happens with adults. Like, okay, this person no longer has migraines, this person no longer has sciatica, but we can't track the
The trajectory of
trajectory
the
of a
child.
child, that was born that way, had it shifted, and now they are a different being with a different vision of how they see the world. And so it's no way of knowing, how that child will change because of that experience. But that's remarkable and inspiring. And obviously you kept going to
That's what I always talk about, to our members and people we teach, and I'm sure you do too, that, you know, the true gift of chiropractic is helping someone reach that true potential. And a
Yeah,
40-year-old with degenerative disc disease, you can make them feel better, but when you're dealing with the infant, especially those first couple of years of life, that's really when you're setting the foundation for their potential and really making a shift, in how they see, how they function.
and
absolutely.
Yeah.
I know
Yeah, no, I was just going to say that I got to follow the family for a good few years. I saw mom through her second pregnancy, so treated baby number two. And then when Sophie was about 18 years old, she came back after sort of maybe 10 years and she says, "Remember me?" And
how
yeah,
could we forget
she
you?
was
How
just
could we
amazing.
forget you?
She was amazing. I said, "Oh yes, I'll never forget you."
We actually had a similar experience recently. We had a little girl. I mean, she was actually written up as one of my case studies. I think she was 5 or 6, and she was mute, like she had selective mutism. And we did write this up. She went on to different lives and college and all that. And she ended up in a chiropractic office at a friend's of ours and walked in at 21 and told the story of like, well, I was under care as a child and I had this experience. And of course, they know us and they were like, oh, that's. And so it was just this amazing connection that she
Yeah,
actually remembered the experience and owned it. And as part of her story, which is wonderful because sometimes children don't know,
yeah.
but so that's a wonderful, wonderful
That's
story.
kind of cool.
Yeah. So I know also that you work also with EDS, which is a specialty of yours. Can you want to speak a little bit about that? Because maybe
Yes,
tell people
yes.
what that is and what you led, to that particular
So
journey.
Ehlers-Danlos syndrome is something that I got diagnosed with myself at the age of 47 after going back and forth to different doctors for 20 years, thinking there's something wrong with me. I've always been super flexible.
Hmm.
I've always been clumsy. I don't think I had delayed development, and I've always been very um, good at school and probably has a touch of ADHD too. And these two often go together, in fact. So when I got the diagnosis, the doctor, a lovely professor of rheumatology, said, "This is what you have, but we can't help you. But you're a chiropractor," he said, "so go out and figure out what works." And I thought, well, that was really generous. Yeah. And thanks for that. Yeah. So I immediately joined the International EDS Association. EDS.org, I think they're called, and joined lots of courses. And there was a lot of things happening around the time about the diagnosing and treatment of EDS. So I educated myself on a very, very deep level. And I'm still a member of their ECHO program, which is actually a free program that you can join as a healthcare professional
Okay.
to learn more about it. And so I see a lot of people now with Ehlers-Danlos syndrome and hypermobility and also other connective tissue disorders because we do have to treat them a little bit differently
Absolutely.
than
Yeah.
Absolutely.
yeah. But they respond incredibly well to cranial work and craniosacral
Yeah.
work. It's all about the fascia and it's all about the tonality and
Right.
much less about the joints.
And when we talk about, pediatric adjusting and tonal adjusting or during ninja stuff, that carries all the way to that group of
Of
people.
course.
You don't want to do a lot of high
Absolutely.
velocity adjusting on those people. And
Nope.
so the work that, we teach, the work that you do really can carry on right through that whole adult population. And it's actually
Absolutely.
the only way they really get good relief. Other times it can be actually
It
more
can, yeah, it
exacerbating
can,
of their
it
condition.
can.
Yeah, yeah. You have to be really wary of
Yeah.
treating them, and you have to know what you're doing.
Right.
Yeah, well, it's very important to build your toolbox that if you don't want to take care of this population, then refer them out.
Or any population,
Absolutely.
building a toolbox, I think, is a really important part of chiropractic. I know for me, and maybe you could speak to this too, one of the ways that I always keep involved is to keep learning, like to
Yeah.
learn, to keep increasing on my techniques or pulling stuff out of my toolbox and, maybe even challenging myself or getting more, as you open up those doors, more challenging people come in. And for me,
Absolutely.
I have a little ADHD too.
That's
Don't, no, I don't have EDS. I might be actually tighter than that, but so I might be a little more of a hyperactive ADHD. But seriously, that's how, I keep my foot back in that door. Like I keep coming back in because as you expand, your practice expands.
Absolutely. And it's fascinating because I've then spent the last 10 years pretty much trying to educate our profession in Europe about it. So I've done seminars all over the UK and Denmark and Italy, and I've been invited to Amsterdam as well to talk about how you diagnose it, especially in children, and how you can prevent the long-term issues that these
Oh,
children
that's
can
awesome.
develop.
Well, speaking of that, so I know you do teach and have taught all over Europe. Tell us a little bit of how people can get in touch with you if they wanted to
Yeah,
study.
you're teaching stuff, yeah, seminars and things like that.
Yeah, so I don't have a schedule like you guys.
So
I just
you're saying,
yes, I just tend to say yes when people ask me. So last year I did 3 courses in Denmark for the Danish Chiropractic Association.
Mhm.
And I'm trying to think, I've kind of taken a little bit of a back seat since moving back home because there were just so many changes, with
of
the
course,
world changing, and so I just maybe do 1 or 2 seminars a year now, much
Okay.
less than I used to do, and it's more on a select basis.
of
Okay.
course.
And I have something in the works for next year in Cyprus, hopefully. So
Oh, that's good.
watch
Yeah.
this space, yeah.
Yeah.
And if I could fit it in, I would come and see you guys in Barcelona
I
next
understand.
month, but I'm
Oh,
not
yeah.
sure I
Well, we're
can.
going to be there 3 times.
Yeah.
We're going to be in Barcelona next month. We're going to be there in November and then in March.
Yeah.
Ah,
Maybe you
okay.
could fit in one of those.
Yeah,
We'd love
That
that.
would,
let us
yeah,
know. We'd love to have you
Yeah,
join us.
we're doing,
Yeah.
Barcelona is just the research. This September is Heidi's thing, and
yeah.
then November
Sure.
and
Yeah.
March is our pediatric certification
Yeah,
program.
we haven't been back to Europe since COVID, so this is our first time coming.
Oh, that'd be lovely.
Yeah, we're really
So if you want to come,
we're looking
please let
forward.
us know. You can
Yeah.
come as our
Yeah.
guest. We'd
Yeah.
love.
I would love to, because I like you were saying before, you always keep learning, and every time I come to your seminars, I always learn something.
I appreciate
You're
that.
never too old to keep, looking up new stuff, and sometimes you think, oh yeah, I forgot about that technique.
Yeah, that's a big
It
one.
happens all the
Yeah,
time.
Especially
yeah,
when you're working, all of a sudden you're working with somebody, you hit that plateau and you go, wait, I remember, and you can just
It
move
often
on.
happens. It's like, because I mean, we're kind of known for over teaching. We have a lot of content each seminar, partly because
but never.
the part is because we would get bored teaching less, and also
Yeah,
because there's so much you need to know to take care of the population of people that are there. But I oftentimes hear people say, I'm never going to do that. And then sure enough, like down the road a little ways, they call it, go, I have this patient. I'm going, remember we told you about this
yeah.
technique? And it's always something like, oh yeah, because so don't never say never, because
But this
it's
is it. This is it.
yeah, life is an adventure and it's full of twists. And so I know you have a very full life. I know you've also an author and you've done many, many things. So it's like your intellectual curiosity is inspiring. How long you've been doing this is amazing. I really appreciate all the work that you did in the UK for pediatrics.
Aw,
I
thank
kind
you
of
so
put
much.
I kind of put your name with pediatrics in the UK because I know you were there pretty much.
Yeah, I was there a long time.
Yeah.
Yeah.
Yeah, and you were there at the beginnings of it,
So now we're looking forward to what you're going to do in Denmark. I'm hoping to hearing lots of things.
Watch this space. Yeah. Like I
Exactly.
say, I tend to let the universe just throw things at me and then go, okay, that sounds good. So, so yeah, I am working on the follow-up on my novel.
I know you are. Yeah.
Awesome.
And yeah, so hopefully, that'll come out next year. And yeah, so I'm working part-time in Copenhagen, and I see almost exclusively children
Mhm.
of all ages, but predominantly babies and pregnant women. And then I've started also seeing a lot of women more sort of my age, postmenopausal women who do incredibly well with cranial work as well.
Yeah.
And because there's only a very few of us in Denmark that use this particular techniques, we tend to get really, really busy, which is good.
I thought you were going to say there's only a few postmenopausal women in Denmark. I was like, oh,
Oh no,
how'd
oh
you
no, no,
figure
no.
that one
No,
out?
but
Killing them
cranial
off at 40.
cranial work
If
just
you're
isn't
still
very
they
well
die.
known here. Oh no, there's loads of those. Trust me.
Yeah.
Generation X is strong in Denmark as well.
Yeah, no,
But yeah, they're cranial work's just not that well known here for some reason. I'm
really.
not sure why. Yeah. So
But it is in England, right? I mean, it's
it
England.
is.
It's based
It
in
is.
osteopathy.
Yeah.
Yeah.
Yeah. And one of the girls that work in the clinic I work in, she's been a graduate for 2 years now, and I've kind of taken her under my wing as a mentor, and she's very keen on learning the
Awesome.
cranial stuff. So yeah, I'm doing my bit on a ground level.
Doing your thing.
You're in fit for chiropractic
Yeah.
too, and for people.
Yeah.
So we totally appreciate you
Yeah.
taking your time this Sunday morning, or well, it's actually Sunday evening for you, right?
Afternoon.
It's
Yeah.
4 p.m.
Yeah,
Yeah.
so Sunday afternoon. But
Yeah.
we appreciate you taking your time, and we really, we miss connecting with you, but hopefully maybe in the next, year or two, we'll be able to connect. We'll be over to Europe a couple of times, and
Maybe we'll
maybe
see.
we'll get to connect.
Yeah. Thank
Yeah.
you so
That'd be
much. And
lovely.
thank you. Yes.
Thank you so much.
Yeah.
Appreciate it, and have a wonderful day, Elizabeth. Thank you. Bye-bye.
Thank you. Lovely to see you both.